Hi, welcome to the Children's Hospital at Westmead. Thousands and thousands of sick babies, children and teenagers come here every year to be treated by our hospital specialists. If you're ever lost, just ask one of the hospital's friendly staff for help. Come on in and we'll show you around. When you walk into the main entrance on Hawkesbury Road, you'll find the main inquiries counter. This is the best place to ask for directions. If you're coming to the hospital for a planned stay, you'll have to first check in at the inquiries counter. The clerk might ask an adult to fill in some forms. Once that's done, they'll tell you where to go next. When someone needs to stay in a hospital for more than one night, they'd stay in a ward, just like this one. So that you don't bring in any germs, it's really important to wash your hands when you arrive, throughout your stay and when you leave. One of the first things you'll see when you walk into a ward is the nurses' station. It's called the nurses' station, but there's usually other people behind the desk as well. So if you ever need anything, you'll always find someone here to help. Each ward has rooms where patients sleep in, and these rooms have between 1 and 6 beds. There's also a bathroom in each room, which is only for patients to use. If you need the help of a nurse, there's a call button right next to each bed. A nurse will come as soon as they can. All patients have their breakfast, lunch and dinner delivered to the ward. On most wards, there is a special parents' room where parents and carers can use the bathroom and have a hot shower. They can also heat up some food or wash and dry some clothes if needed. One parent or carer is allowed to stay overnight at the hospital. On most wards, they can sleep in a pull-out bed by the bedside. Some wards have play areas with lots of toys, books, games and activities. These are special places where kids can escape their treatment and just have fun. This is the outpatients department. This is where most people go when they've got a booked clinic appointment at the hospital. When you arrive, you'll need to check in with staff at the front counter. They'll tell you where you should sit while you're waiting to be seen. Because so many people come here for appointments, you might need to wait a little longer than expected. It's always a great idea to bring a book or a toy to keep busy. When it's time to be seen, a staff member will usually call you to one of the outpatient clinic rooms for a checkup. Sometimes you might be asked to make another appointment before you leave. The staff at the front counter can help you do this. Most people who come to the hospital for an operation will come to the day surgery, Middleton ward. When you arrive, you'll need to check in at the front counter. Sometimes you might need to wait for a little while. This is usually because other operations take longer than expected, or someone might come into the hospital unexpectedly and need emergency surgery. There'll usually be a lot of people who will come and see you before an operation, like a doctor, anaesthetist and nurse. They'll usually chat to you about the operation, answer any questions you have, and make sure you've been weighed, measured, and given special ID bracelets. When it's time to have an operation, a nurse will take each patient and one parent or carer to the operating theatre. The first place you will go is the check-in area. This is where a nurse will check that each patient's details are correct and make sure that everyone is wearing the right clothing. Once all the checks are over, you'll be taken to the anaesthetic bay. This is where the patients are given special medication to help them sleep. A parent or a carer can usually stay there until the patient has fallen asleep. Once the operation is over, patients will be taken to the recovery ward. Medical imaging is where you go to have an X-ray, ultrasound, CT scan or MRI or other special tests. The first thing you'll need to do is hand in your referral or booking form in at the front counter. Once your name is called, you'll be taken into one of the scanning rooms. A special technician will explain what is involved in the scan or test and help you get into the right position. This will help them get some really good pictures for the doctor to look at. Unless they're pregnant or sick, one parent or carer is usually allowed to stay in the room. Depending on the type of scan or test, they might need to wear a special vest or stand behind a screen. Unfortunately, the technician can't tell you what the results of your scan or test are. Once your doctor has your results, they'll let you know. There's some really great places to play in or visit while you're in the hospital. There's the Starlight Room with lots of special competitions and games, or the Book Bunker Children's Library. If you feel like getting some fresh air, you can also explore the Children's Garden, the Chinese Gardens, and the George Gregan Playground. But don't forget to check in with your nurses before you leave the ward. We hope this tour has given you an idea of what to expect when you come to the Children's Hospital at Westmead. Don't hesitate to contact us if you have any questions about your stay.